Welcome back to Dr. Noah's YouTube updates, and just kind of interesting this last week, which kind of just startles me in terms of what's really going on out there in terms of so-called health care. Of course, we got the big issue about the United States is into tens of trillions, if not hundreds of trillions of dollars, and we've talked about that the medical profession, the sick industry, is a contributing big factor about that. Here is an article, July 21st, so it's just a couple days ago like that. Multiple sclerosis drugs cost greater than their benefits. Well, the benefits are almost nothing. We've gone over the studies that over a 10-year period, there's really nothing, no change there. There's sometimes 1 or 2 years, a little bit what so-called what appears to be palliative care is wasted. What they were showing here is that, man, this is nuts. You can't just do stuff that you think is really good for people where there was no science showing a benefit, but the cost, the average cost for multiple sclerosis is $100,000. I mean, we don't have $100,000 per MS patient. That's stuff that doesn't work, and that's what this article goes into. The University of Rochester in New York State, it said this was published in Neurology. That once again only gives you two extra months of little bit of palliative care for $1 million over 10 years. I mean, it's just nuts. So you just have to kind of understand what's going on here. And a follow-up on that study, here's a study that was published. It's a meta-analysis, looked at all 61 studies on breast cancer and SSRIs. Yeah, that's your Prozac and Zoloft and all those other type of garbage that we've shown you over and over again. Even with severe, definitely mild to moderate, there's no different than placebo, costing us hundreds of billions of dollars. These things all add up. And this, once again, where's this money come from? People, oh, well, I got Medicare, I got insurance, I go see my drug doctor, they give me this crap that doesn't work, but, costs $200-300 a month. That all adds up. You got to get it in your head. So what they found out, which is no surprise to me and people that listen like that, is that out of the 61 studies, those studies that were done and sponsored by or the doctors were affiliated with the drug companies showed no correlation of SSRIs causing breast cancer. All the other ones, the other researchers showed, once again, that when it wasn't affiliated, there was a 43% increase in breast cancer when you take this crap. So once again, it doesn't work, doesn't make you feel, I mean, depression's a terrible thing. It's once again, not fun. I've been around both patients and friends. It's a devastating thing, but there's lots of natural things out there, and kind of keep your eyes. I'm working with Cindy and another guy, John, like that. We're going to start putting little booklets together of showing you real stuff that you can do yourself. I mean, and especially with the rising in terms of not having insurance, or well, that's the other thing, is that your deductibles now. I just had a patient, $5,000. You have to pay up to $5,000 before your insurance kicks in. I mean, this stuff is becoming worthless. I mean, it's just nuts. So that's a whole other story here. Is that's what the science shows, is that a lot of these so-called things that you see on TV and stuff are infomercials. They're paid for. The scientists are, once again, are prostitutes for and they create these scientific studies that aren't science. It's an infocommercial saying, yeah, this is the great new wonder drug and it's great, and for $500 a month this is going to help your problem, and of course it doesn't. So as the scientist here stated, that the existence of research industry associations points to generic risk that a financial conflict of interest may compromise, I don't know, I'm from New Jersey, does compromise the research process or undermine the public trust. And that's the issue here, is that people have the trust to thinking that they go to an expert like myself or another doctor and hoping that once again, their interest is your best interest, not what's behind them in terms of money that they're kicking out and paying for these drugs. The last one, which we've talked a lot about, are cell phones. And in this last week, there was 2 studies and it goes hand in hand with this. The first study showed that there's absolutely no type of correlation between cell phone use and what's called ipsilateral, one side acoustic and brain tumors, acoustic neuromas, like that. Then in this study that was not affiliated with, once again, the industry, published in Experimental Oncology here, showed that it did. It, quote, nevertheless, even a year of operation of a powerful base transmitting station of mobile communication cell phone reportedly resulted in a dramatic increase of cancer incidence among population living nearby. So these cell phone transmissions, the cell phones do. So that's the problem. You'll see, because, hey, the insurance the media are prostitutes too. Every second on the internet, what do you hear? You hear AT&T, Verizon. They spend billions of dollars advertising on the media. So you think they're going to say, well, yeah, let's listen to Dr. Noah saying this is very dangerous. Yeah, they won't pay them, and that's what's good. So our civilization has been distilled to everybody's bots. You got the money, they'll just look the other way, and it's just tragic here. So there's just two little updates. Once again, spending millions and billions of dollars for MS, for drugs that doesn't work, that's garbage. That SSRIs or antidepressant drugs are linked to breast cancer. Once again, when they looked at the 61 studies, those were sponsored by the drug companies like that, showed that there was no correlation between antidepressants and breast cancer. And then the people that are independent, and we've talked about, that's what's called third party, which is the best. And we've talked about a nerve 2 activator that's kind of exciting, that actually does have science that benefits you and helps with depression, that showed that a 43% increase of breast cancer. So this is just nuts. People wonder why, I've been so healthy, I eat organic food and I got breast cancer. Well, let's go through the 75,000 things that can cause breast cancer, that even doing all those things you're exposed to. Oh yeah, you take drugs? Well, hey, let's start with that. You take SSRIs? I don't care how much organic food you have, that stuff is garbage. Then we talk about the air pollution and the radiation, and it's just nuts. So with that happy notes, have a happy week.